We are going to have a conversation about solutions, because we know that there's not going to be one solution to these kind of issues around heroin abuse and heroin dependency and the increasing amount of heroin deaths that are happening in our community, as well as the use of these designer agents and designer drugs.
We talk about things like K2 and heroin and other substances. A lot of what comes out of what we see is in the community, no matter where you are. So the large homes and the fancy cars, they have drug problems too.
It's in bright colors. Again, it's marketing, and it's also sending a message that it's not that bad. If you can sell it in a convenience store and you can get a Mountain Dew with your Scooby snacks, it's not that bad. But unfortunately, we do know the effects. And so these young adults know that it's bad too.
So once addiction occurs, and the people who are vulnerable to it, many of them are genetically vulnerable to it, many of them come into it naively, but once that happens, it's like forming a dry creek bed in a desert.
I'm also a person with lived experience with heroin addiction. I identify myself as a person in long-term recovery, and I've been in recovery since 1998. There's a lot of stigma attached to being an addict, and what I personally try to do is try to remove that stigma.
I have never met anyone that has said to me, when I grow up, I want to be an addict. Not once.
So to have people know that there's help out there, that there's other people that have the same struggles, I think that's a great help for people.
The last thing I want to say is this is not a Willimantic issue. This is an issue in Fairfield, this is an issue in Glastonbury, this is a problem in Cheshire, in Madison, in Guilford, in Danbury, in Wolcott, in Waterbury, in New Haven, in Groton. There are people in every community who are dealing with these issues. The difference is we here in Willimantic are coming together to have a conversation. We really know that if we're going to make an impact on these kind of issues in our community, it's going to take all of us working together on these topics.